Minister, COVID-19 has wreaked havoc on the psychological well-being of many in our society, and in many cases has been indiscriminate to age, gender or financial standing. We have all had to accept the necessity of business restrictions and lockdowns at the early stages of the pandemic. But the effects of constant isolation, financial pressures, sickness and loss has taken a very significant toll on many of our population. As we try to navigate our way out of this pandemic, the full psychological impacts that have resulted are only starting now to become apparent. Pre-COVID-19, we had an acknowledged deficit in many areas of psychological assessment in this country. One of the most topical remains the psychological assessment of children with early learning disabilities, but sad to say that deficit is now also extending to adult evaluations also. We do not have and never have had adequate psychological and counselling supports in the public system to cater to need, and where they do exist, they do not have the capacity to cater to the more serious psychological problems exhibiting now far more frequently. We have parents trying to access onward learning and disability services who are waiting months and even years for psychological assessments and approval to enter learning disability care pathways. The Department of Children still continues to not recognise private psychological evaluations for learning spectrum disorders, which can be provided within weeks. Instead, we force patients to wait and access the public list, even though waiting times can extend up to 2 years. This is a fundamental deficit that must be challenged and changed radically in this country, given the extraordinary monies we are presently spending in other COVID support areas. Psychiatric services too are at breaking point in the country. In my own city of Waterford, Minister, which you are well aware, the regional hospital UHW, we have no 7-day psychiatric access, no on-call service at weekends, and the only admittance at weekends possible to the psychiatric department is via the emergency department through referral. Even at this, we have no child psychiatry services or beds available at UHW, which requires child patients to transfer to Cork, which adds to the trauma for many parents and children arriving into their local hospital after some psychological event. Staff recruitment and retention in the psychiatric services has long been a problem both in UHW and nationally, and is being exacerbated now by the increased clinical waiting lists, the extended workloads, the lack of available follow-on bed spaces, and the recurring nature of psychiatric illness. In addition, we are seeing significant amounts of anxiety and depression in our older age cohorts who have been forced to isolate away for months on end from family and friends. And indeed, those presently in hospital still suffer restrictions on family visiting time, despite the fact that nearly all hospital staff are now vaccinated. Despite the opportunities of identifying possible infection risk by using antigen testing in hospitals to screen visitor infection, the HSE continue to avoid any implementation of antigen testing which could resolve this issue. This, in my opinion, remains a dark stain on the reputations of many of those charged with leading our national medical response to COVID. We are seeing too a dramatic rise in the number of people who are becoming overwhelmed by financial pressures because of COVID, which are leading to increased anxiety, depression and suicide. There are a significant body of people, most privately or self-employed in this country, who have fallen through the cracks in terms of receiving adequate or any state support to preserve their businesses and occupations, as restrictions force them to cease operations. If ever there was an example of disparity between the public and private sector's pay divide, it is now most clearly evident in the treatment and the situation that many in the private sector find themselves, where their livelihood and their financial reserves have been wiped out. Meanwhile, they look at those of us publicly employed who have suffered no disruption to our income because of COVID. Such inequity does not do much, and it does much to harbour rage, anxiety and challenges self-esteem, which leads to chronic depression and mental trauma. The rise in social media activity too is also creating esteem and addiction issues. The recent evidence of post-traumatic stress being suffered by social media moderators, the rise in online gambling destroying family incomes, The image and body sharing narratives polluting young and vulnerable minds, leading to a lack of self-worth, eating disorders, suicidal ideation and sometimes suicidal acts. If COVID has taught us anything, Ceann Comhairle, it is the need for people to be with other people. It demonstrates the brittleness of the consumer society that we have been building for many years, which has been leaving so many isolated and alone in its wake. We are not out of COVID yet, but we must begin a new national conversation, one that seeks to enhance life at all stages, that includes all differentiation, that seeks to value that which we had forgotten and which we have only recently rediscovered. The understanding that we are all vulnerable, yet invaluable, that we are all in this together, and that for our society and people to prosper, all must be included, all must be supported. Community must be at the heart of the future political decisions we take as we try to heal and rebuild from COVID-19. And Minister, could I make one further point just in terms of the new public strategies in terms of releasing from COVID, and that is about resilience. We haven't mentioned resilience anywhere within the Back to Work schemes in terms of new business improvements, and I think we need to look and build a resilience component across all department policies over coming months as we try to frame a narrative to leave this pandemic behind us.
Thank you.